Hey, KAWP fans, we're here today with Dr. John Mullins, and Dr. Mullins is the owner of Marshall Lifestyle Medicine here in Lexington, Kentucky. And Dr. Mullins, thank you for being with us today.
Thank you for having me.
We're going to talk a little bit today about something, it's been around for a while, but I think it's kind of making its way more into the mainstream with people. It's called a PRP. That's an injection that you can give somebody for some of their maladies that we may have.
Sure.
Would you mind telling the audience what PRP is and then kind of some of the uses that we can have for
Sure.
it?
PRP stands for platelet-rich plasma, and I love it. I've been doing it for the last 5 or 6 years. We see a lot of athletes in my practice and weekend warriors and at a variety of different skill levels. But I've always loved it because it replaces some of the ways that we've previously treated some of the chronic tendinopathies / injuries that we develop over time. And what it is, we draw off your blood, centrifuge it, and take off the red blood cells, and then we're left with two different components: platelet-rich plasma and platelet-poor plasma. We centrifuge it one last time, and because we're really interested in the platelet-rich plasma, which is the platelets plus all the growth factors. We still utilize the platelet-poor plasma for other things. It comes out, it looks like kind of like a straw-colored, looks serum basically, and I kind of a miracle concoction. It's not a medication, it's something God gave us, and I make a joke about it. You can squirt it up in the air and just kind of run under it. Wherever it hits you, it's going to do something good. I use platelet-rich plasma for a variety of different things. I apply it to men's scalp to get their hair to grow. I use it in the course of doing aesthetic techniques for men and women, and it enhances their appearance. I think today we're talking more on the orthopedic side, and I do a lot of sports medicine, and the guys and girls that come in that lift weights or play golf or play tennis or they run or things that we're trying to get them to do oftentimes develop these tendinopathies that are nuisance, even more than nuisance issues, where they've previously gone to the doctor, been prescribed anti-inflammatory medicines. And this stuff just seems to, when injected properly in the right circumstances, the growth factors just seem to cause a healing that our body would have done naturally maybe when we were a little younger, and we've lost that ability again as we've gotten older. But when you've concentrated and put it in the area, I'll use like your elbow for instance. Guys get lateral epicondylitis a lot. When you inject in that area, it just repairs the damage and subdues the inflammation and allows the return to normal function in a way that nothing else really does.
And since it's your own blood, there's no chance of any issues like with taking medications. Sometimes you can have a reaction to it. So I assume with it being your own blood, there's very low chances of any reactions.
No, none of that. I mean, I guess there's always the chance that the person that's injecting you does it in a manner that may cause some damage. However, when done by a person who's experienced in the field and knows where to put the needle and how to inject it properly, I think it's one of those procedures that really without risk. And it really works more often than not, as long as you're using a patient that is the right patient for that particular treatment modality. And a lot of things that maybe even you're seeing in the course of physical therapy or things, sometimes just you reach a point where you're just not seeing a lot of benefit. And I see a lot of guys and girls in my practice that have gone and done this and this for a while time, and they're still aching and they want to get back to lifting weights, running, playing golf, playing tennis, doing the things that they like to do. And PRP just seems to work in a way that nothing else does. And for that very reason, I just love it. And it's in that field of regenerative medicine, which is kind of up and coming. And I'm sorry about that, Kelly.
So my audience will want to know, how many shots does it require? How long does it take before you get some results? I know that's a question you can't really answer. But
No. I think those are good questions. And I think for the run-of-the-mill, a person that has a tendinopathy, so tennis elbow, golfer's elbow, rotator cuff tendonitis, Achilles tendonitis, plantar fasciitis, all these itises that people, they drive them crazy. You can't perform normal activities when you have those things. It's a one-shot deal.
Okay.
When I use it for purposes of hair regrowth and things, our hair follicles grow at different rates and different sequences. You have to do 3 different injections separated by some time. But the majority of the orthopedic things that I'm seeing, short of if you were treating somebody that had more of an arthritic condition that was chronic and you're going to do more than one, oftentimes 2 or 3 in treatments. For instance, for a person that has mild to moderate arthritic knees, you're going to probably have at least 2 different injections for that. But the run-of-the-mill tendinopathies, it's a one-time deal.
That's fantastic. And what about if you get an injection in, let's say, something in your spine? Is that a possibility if somebody has a bad back?
Yeah, I think there are people that are dabbling in that field. I don't personally. Okay. It's a little more invasive than what I want to do in the office. Those things have to be done under ultrasounded guidance and things that I just don't want to do. But theoretically, PRP should work on anything that is an inflammatory condition. That's one of those tendinopathy type things. And a lot of times those back ailments are mild or small areas of inflammation that you just can't get to with conventional means. And it would work with that, I would think.
So you said you don't get that invasive. So do you do these procedures in your office?
I do. Absolutely.
Okay, so people don't have to go to a hospital.
No.
They don't have to go to a surgery center.
No. In the procedure itself, another question, people, how long am I going to be there? They're in our office for 45 minutes, but the vast majority of that time is just them drawing your blood and centrifuging it. The procedure takes sometimes 20 seconds.
Okay.
And it's relatively painless. I mean, you are sticking a needle through their skin, so there's a certain amount of just minor discomfort. But it really is, I would call it a 1 out of 10 discomfort. And it's and then the other question you asked me is when can they expect to see improvement? You kind of have it's kind of biphasic. In the first couple days, you'll notice improvement. That is the inflammatory things that are naturally occurring in your bloodstream that just put the inflammation at bay right then and there. And that happens on day 2 or 3. Sometimes that'll come back as that effect wears off, and then the definitive treatment, the growth factors that are going in and causing definitive repair, that's about a 2-week delay. And you will start seeing improvement at the 2-week mark, and it'll go on for another several weeks till complete resolution.
Okay. And does it require a lot of blood to donate, or do you just donate?
One vial of blood.
One vial, okay.
1 vial of blood. It's really fascinating. We centrifuge it. You have to have a special filter, a special centrifuge. And I would caution, if a person's going out to have this done, there are a lot of places that are touting PRP. It's a really cool procedure. Make sure you ask those kind of questions, like what type of filter are you using, because there's ones that are not as good as others. What type of centrifuge? We have the one there is, because you really want to concentrate it, and it's not everybody that's doing PRP is doing it the same way.
Okay.
And I'd also, just like in your profession, not everybody has the same skill with injecting either.
Right. And you've been doing it for a long time.
And I did a lot of I started in orthopedic surgery, so I've always had an interest in sports medicine and those kind of things. And in my lifetime as an emergency room doctor, I did a lot of joint injections. I always felt like that was a better approach than giving people non-steroidal anti-inflammatory medicines to take into perpetuity for something that could be treated with a one-time shot.
Yeah, because that's systemic. It gets into your blood, and this doesn't. What about people who are considering joint replacements? Maybe they have pain in their knees and they've talked to somebody about a joint replacement. And I've always told them, wait as long as you can. You don't want to wait too long, but wait as long as you can, because the technology is getting better. Is this something we can use to maybe buy a little time?
I think the right person, there's some people that are so bone on bone that you're just not going to get enough benefit probably in that regard. If somebody is considering, but they're still mobile, it'll buy them some time. And sometimes, a lot can happen over a period of time. So if a person is they're just not ready to undergo the knife, for whatever reason they're just not prepared for it, PRP will buy you a period of time where you could be either in less discomfort or improved functionality, or both.
So it can buy you some time on some things like osteoarthritis, but you get complete resolution on some things as well. So
Absolutely.
It's fascinating. I really think that things like PRP and the peptides that we've discussed is really the future of medicine. And before I let you go, I did want to, if it's okay with you,
Sure.
I know that you were opening up your practice is growing, and you're opening up a new facility in Lexington, and you're having a get-together or a social, so to speak, so people can come and see your facility. Would you mind telling us when that is and where it's located?
Sure. So we were going to have an open house, just to kind of have a grand reveal for our medical practice and our new gym that's adjacent to it.
And golf, don't forget that.
And golf. But the more I was thinking about, the last 12 months have been such a crazy year. I'm trying to downplay the fact that it's an open house, and I'm trying to just do a give back and give people an excuse to come out and be social. Okay. So we're having some live music, some adult beverages. We're doing some giveaways, and I'm really just trying to give people an opportunity to come out, interact, maybe take your mask off if you've been vaccinated, get some sunshine on your face, and start living life again. And if we can be a part of that in some way in the future, I'd love to help these folks. But if nothing else, I just want to come out myself and have a good time and interact with people, because it's been a while.
Yeah. And when is that going to?
Oh, it's April 24th, and it's between our two offices in Beaumont Center Circle, next to the big American flag, and it's from 9 to 5.
9 to 5, April 24th. So all you KAWP fans, if you're interested in coming and seeing Dr. Marshall, you'll be there and see his new facility. We invite you out. And Dr. Marshall, thank you so much for your time again.
It's been my pleasure again. I've really enjoyed chatting with you.
Okay, thank you so much.
Thank you.